Everybody, and welcome to tonight's Facebook Live. My name is Nancy Abdu. I'm the CEO and founder of the Australian Dermal Laser Institute, where we bring you a whole heap of aesthetic training right to your clinics, either face-to-face or online if you can't make it. So we deliver a whole heap of training, whether it's on IPL, laser, radiofrequency, needling, plasma fibroblasting, I'm sure there's a whole heap more: fat cavitation, laser, carbon facial, laser tattoo removal, laser genesis, and the like. And if you already have a device and you've had manufacturer training and you're not too sure how to maximize your results, then drop me a line. I'd be more than happy to help you. If you've joined me on Instagram, welcome. Thank you for joining me on this amazingly cold Wednesday evening. And if you've joined me on Facebook or YouTube, welcome, and thank you for joining me as well. Nice to see a lot of you hopping online tonight. But before I start speaking about LED and the wonders of light, I just want to tell you a little bit about next week. Next week I have Grey Tont from Hood, who is, she's living in St Kilda, on the great, amazing land of Queensland, but her clinic is in St Kilda. And next week she would be joining me to speak to you about education and professional development and what it means to her and her clinic and the success of not just to the treatments, but to the business as a whole. So if you're free next Wednesday night at 7:30, make sure you join me and Gree for an in-depth conversation about why training and professional development is really important. Joe, yes, this is always recorded. So if you can't join me live or if you can't continue to watch, then yes, it is always going to be recorded, and you can either view it on Facebook, on the Dermal Australia Laser Clinic Facebook page, or it'll be uploaded in a while. Not too sure how many days it takes for us to upload onto YouTube. So definitely recorded. But Joe, thank you for joining me from the United Kingdom, all the way from the UK. All right, you're welcome, Joe. So LED, what is LED? Why is it so amazing? Why do I love it so much? Why, if you're starting a clinic, or even if you're an existing clinic, if you are even just starting out, it is the first piece of equipment any clinic should have, any business should have, any hospital should have. I'll tell you why. But what actually is LED, the importance of it, how you can maximize not just the ROI, not just your return on investment, but how do you maximize efficacy? How do we maximize the results and enhance results so clients keep wanting to come back for more and more treatments with you? What sets you apart in a clinic scenario? Let's say you have got 5 or 6 clinics in one street. What is going to set you apart? And yes, a treatment is a treatment, and anyone can perform a treatment, but when you perform a treatment with love and passion and amazing prep work and enough and sufficient post-care, and we're not just talking about 1 or 2 days post-care, we're talking about 3 to 6 months post-care, to maximize your results, clients will want to come back to you. What sets you apart? And I think LED is the answer. Well, it's a big part of the answer. So let's have a look at what LED is, what it stands for, what it does, what wavelengths there are, how can you utilize it in what I call your skin care journey. So your clients are wanting to come back for more and more treatments with you, and they remain loyal to you. So first and foremost, LED, light emitting diode. Light is light. A packet of light is called a photon. And whenever you see the word photo, you just know it means light. So when we see photodynamic therapy or photography, or what else is there, photo rejuvenation, that means light. So when it comes to LED, it is basically what we call photomodulation. So what we're doing, or photobiomodulation, what we're actually doing is we're modulating a cellular activity or response, depending on the wavelength. So for example, if we're using 415 or 420 nanometers, we're modulating the amount of bacteria. And we do that by reducing, not reducing, but exposing the P. acne bacteria, so your porphyrins, to your blue light, and it reduces the bacteria with that exposure. There's a more technical, obviously, cascading effect. I'll get into that in a moment. But with acne, it's reducing the acne. With our red LED, so roughly around the 633 nanometers, it is modulating a cellular chemical reaction, if you like, and it is increasing our ATP, so adenine triphosphate, cellular energy. So photomodulation or photomodulation, basically we're increasing or decreasing a cellular response or activity. So that is essentially what LED does, and it's a reaction that happens at a cellular level. Of course, depending on the wavelength you're using, what cellular response or change or reaction will depend on that wavelength. But essentially, in a nutshell, that's what LED. It's just light. And as you may or may not know, different wavelengths measured in nanometers, and a nanometer is a millionth of a meter. So if you think of a meter, a millionth of a meter is absolutely tiny, really, really tiny. So a nanometer, depending on the nanometer, will determine our depth of penetration. So the smaller that number, the more superficial that depth is. So for example, 415 nanometers is quite superficial. It is what we consider a short wavelength, and it reminds me of the beach. So the beach has small waves, they lap up really quickly to the shore, and then there's a lot of them. All right, so 415 is quite superficial. Let me get my hair. Oh, it's all the way over there. 1 second. Oh. Cannot live without this thing. So 415 nanometers is the most superficial of the waves, and it is, of course, addressing our P. acnes bacteria. And what it actually does is it converts a porphyrin into an O2 molecule, O2 being oxygen. And so what that does with oxygen, you get an increase of cellular respiration, you get a reduction in bacteria, and therefore the P. acne bacteria, or that particular acne lesion, reduces in severity and size and duration. So that's why we love our 415. It could be, 410, 420, within that range. So 415, give or take a few nanometers, is what we see, the human eye sees as your blue light. Hello, Nina. And so that is the most superficial of the waves. Moving on, we have 525 nanometers. 525 nanometers is going to be roughly targeting our papillary layer. So it's not as superficial, it's traveling a little bit deeper, and it is going to be anti-inflammatory, but at a superficial level. So it's going to reduce facial redness, facial flushing. Hold on. Can you open the door? He's going to keep meowing all night. All right. 525 is going to, like I said, reduce the appearance of telangiectasia, rosacea. It reduces superficial inflammation, thereby also reducing hyperpigmentation. So if you have a client who has maybe sun damage or deeper pigmentation that presents itself as melasma, our 525 nanometer wavelength is actually going to be quite calming, and it's going to calm that melanocyte activity down because of that reduction of inflammation. And so we see a reduction in melasma. Not only that, it's non-thermal. So all LED is non-thermal. So within not even 4 treatments in my clinics, I used to see an amazing improvement with melasma. And I know how hard melasma is to actually to manage. We're never going to treat it, we're going to manage it. So green, although it is the most understudied wavelength, I find it is the most useful wavelength. And surprisingly, there are not that many LED devices out there on the market that actually utilize the green wavelength. I don't understand it, but I'm going to change that, and I'll tell you at the end of this video how. All right, so moving on, we've got a 525. Then we've got a deeper wavelength. So some companies will use 570, 590, but that looks like our yellow wavelength. Looks like a yellow color rather. And so basically that's going to penetrate just a little bit deeper, and that is ideal for burns, for bruises, for toxin clearance, to a certain extent for circulation. So I find it's a useful wavelength. Is it my go-to? I'll talk about that in a second, but you have your yellow. Then we have a deeper wavelength going down to the mitochondria, which is our 633 nanometers, which looks like a red wavelength, or red color rather. Now, red is one of my most favorite LEDs, and I think it's, again, underutilized. People just think, oh, it's just for collagen stimulation. It is, but it's not. I'll explain in a sec. But red penetrates a little bit deeper. And if you look at the colors of the rainbow, blue's always on the outside, bending the most, so it's the shortest. And as we keep going, we've got our green, then our yellow, then our red. So red bends the least, and it's quite deep. Reminds me of the ocean. So with the ocean waves, they actually come to the shore a lot slower, but they're bigger, deeper waves. So our red-white wave is going to penetrate deeper than our blues, our greens, and our yellow. Now, like I said, red's like one of my favorite, apart from green. The reason for that is, let me give you an analogy that's going to help you. If you have a remote control, and if you've trained with me, you've heard this a million times, but if you have a remote control and my remote control batteries are on their way out, they're dying, and I press play, what do you think is going to happen? I'll press play as hard as I want, but it might not work, or I'll have to get really close to the TV for it to work, right? But if I recharge my batteries and put new batteries in, or recharge them, I press play, record, rewind, and my remote control works the way it's supposed to. This is the best way to explain your red LED, because that's exactly what it does to our skin cells in the mitochondria, right? It increases cellular energy, what we call ATP, adenine triphosphate. By increasing your ATP, we're actually making the cells work the way they're supposed to work, like a young cell again. I'm going to give you another analogy. If I cut a 20-year-old and a 60-year-old, how do you think either of those are going to heal? Your 20-year-old's going to heal pretty rapidly, not a lot of inflammation, and the scarring will probably be not so much scarring, depending on the type of cut, of course. But we know the repair and the wound healing is quite rapid. Whereas my 60-year-old is probably going to take twice as long. It's going to remain inflamed for a lot longer. And when our skin remains in the inflammatory phase for much longer, what happens is we end up with a little more scarring, like I said, more downtime, and the wound healing is compromised. It's not great. So if you needle or do HIFU or radiofrequency or laser or you name it, a peel on a mature skin whose skin's batteries are depleted, how much wrinkle reduction, scar revision, how much remodeling do you think that mature skin's going to get? You can do RF or needle as much as you want, and you can get as much controlled injury as you can get. Do you really think you're going to get really nice, healthy, good quality wound healing and collagen remodeling happening? Probably not. And in fact, by the time we've reached 60 years old, it's been proven those ATP levels have actually halved. So if you think my skin's batteries, if they're only half energized, how much collagen am I actually going to get? Half, right? But if I recharge those batteries so they're nice and full and I needle my client, I'm going to get a full result. I'm going to get a response that, you know, both the client's happy with, and so am I, with the least amount of inflammation and post-inflammatory hyperpigmentation, and without all the downtime if the skin cells weren't energized. Does that make sense? So red LED, I think, is one of the most important wavelengths for that particular reason. Because anything else you do in your clinic, if you're not recharging those skin cells batteries, what's the point? You're wasting your client's money, you're wasting your time, and there goes your reputation. Because what are they going to think? They're going to think, oh, this treatment's crap. My therapist didn't use the right settings. When all along, that skin wasn't at its optimal regenerating, renewal capacity. So red LED, if you're not using your red LED on your clients before a treatment, on the day of the treatment, right, before, and 2 weeks prior, and for 3 to 6 months post, you're not just doing yourself a disservice, you're doing a client a big disservice because you're not maximizing those results. So red LED definitely has its place. Many people will ask me, do you do red LED before needling or RF, or do we do it after? It all depends what you're trying to achieve. If we've just performed a wound, a controlled wound on a client, why would I want to go and do red or infrared LED immediately after to try to inhibit the inflammatory response? Why not do it just before? Unless you're treating an inflamed skin condition. So if I'm treating someone with melasma, with rosacea, with really, really inflamed acne, or any type of inflammatory skin, I will then go and do my LED straight after to try to really calm that skin down so there's not too much inflammation in the skin. And speaking of inflammation, when we're overloading the skin with that inflammatory response, or when the skin is in a prolonged state of inflammation, definitely for more than 3 days, then we see an aging impact rather than an anti-aging impact. So definitely LEDs post-treatment within 24 hours has its place, but immediately straight after, maybe not so. Like I said, unless you're treating melasma, rosacea, or an inflammatory skin condition, okay? Someone's got a question, I'll come back to in a sec. Then, of course, we have our infrared or near infrared. So roughly, depending on manufacturer, it could be roughly between 810 to 830, and it'll be one of the deepest wavelengths. I love infrared for many reasons. I think red is still my favorite, but infrared is really good if you've got deep inflammation or pain, or you're wanting to regenerate soft tissue or muscle, or like I said, you're just trying to really sort of calm the skin down. So infrared is great for that. It doesn't have a specific color that is visible to the human eye. A good infrared, if you get your camera and record, the LEDs will come up as purple on your screen. Even though we can't see it with our naked eye, it'll come up as a purple hue on your screen when you're videoing it. And that's how you know that it's actually on. Some manufacturers might put a row of orange or different colors LED so you know that the device is on. But any good device that has adequate levels of power, and I'm going to come to power in a second, you'll see that as a purple hue through your phone. So like I said, infrared's great, definitely has its place, for those skins where you're really wanting to help that wound healing. I don't know what's happened to my MacBook. Give me 1 second. I've just lost it. Oh, great. Got all of that. Hopefully it's still recording. All right. So that's your infrared. And like I said, definitely has its place if you're wanting to reduce the inflammation. The other thing before I move on to energy and dosage and biphasic dosage, which is really important, I want to speak about the therapeutic benefits of LED, both red and infrared, on your brain. So many of you may not know this, and I'm sure not many of you do if you've only ever looked at the skin, but there are therapeutic benefits of exposing your head, right, your face, to red and infrared. And that is, what it does is it actually increases the synapses in your brain, which is your cell-to-cell signaling pathways, if you like. So by increasing those cell-to-cell signalers, or your synapses in your brain, you are actually not recovering, but rejuvenating grey matter in your brain, which will help with so many different things. There's lots of clinical articles stating that it helps with Parkinson's, it helps with stroke patients, it helps with brain damage. There was one study that I read where there were several patients who, after a stroke, who couldn't move a certain side of their body, had so many LEDs, and after 6 weeks of LED, I can't remember how many LEDs they had, but after several weeks, 6 weeks of LED, they actually started regaining movement. So it's actually really, really good for brain function. In addition to that, it increases your serotonin in your brain. So calorie-free serotonin. Yes, you don't have to go and look for the chocolate to increase the feel-good chemicals in your brain. You can do that by by exposing your brain to red and infrared wavelengths. And so we know in England they have SADS, so seasonal adverse disorder. There's a high level of depression because there's a low level of natural sunlight. And so instead of popping every person onto antidepressants, what they're doing now is they're actually putting them under red light therapy to increase those feel-good chemicals in the brain. So when you have a client under LED, it's not just the skin that we're helping, we're actually helping their mental health to a certain point. How amazing is that? Absolutely amazing. There's so much more in terms of benefits with brain and brain function and what LED does. But at a superficial level, I think they're the two amazing things. It increases the synapses and it increases your serotonin in your brain and your endorphins. All right, so let's talk about dosage. But before I do, I've got a couple of questions that I just need to quickly have a look at and catch my breath. If you're liking this, give me a little love heart. So many people don't seem to like posts anymore. I know I don't, but it's nice to know that you guys are enjoying my lives. Flossy Man, okay, hi. So do you do red light soon after or 3 to 7 days after needling? I'll just wait 24 hours because all the love hearts are coming up. I love that, I feel loved. So if you're doing your LED, you want inflammation to kick in and you want that to sort of, the inflammatory response to be there for, I'd say, a few hours. Now, it's really hard for us to expect our client to come back in after 2 or 3 hours. So I just say, look, come back in 24 hours. Let me do a quick checkup, chuck you under the LED, and that way we're getting in a session and we're actually having a review of their skin. So definitely the 24 hours after, the skin has undergone inflammation for the first 24 hours. Now we can start calming that skin down. We definitely don't want inflammation for more than the 3-day period. Like I said, there's been some studies there to show that prolonged inflammation does the reverse. We had another question. Christina, I need to answer your message. I've been so under the pump, I will. Christina saying, all the way from Perth, is infrared okay with clients with precancers or best to avoid all LED? That's a really interesting question. And I actually had a conversation with a, what do you call her? An oncological dermal therapist, if you like. And we're both sitting on the fence, and I'll still sit on the fence because what we believe is if LED feeds and helps cells strengthen, what if you have a mutated cell? Are you strengthening that LED? So if it was me, I wouldn't treat. If the client is insisting, I would get a letter from their oncologist or their treating practitioner, and I would get them to sign a waiver to say that you take no responsibility should that cell mutate or spread any further. I personally wouldn't do it. And the other thing you need to consider is your insurance company. So if your insurance company says, you can't treat anyone 2 years after remission, then you just can't. Some insurance companies will say 5, and some will actually say 10 years. So, one is getting a medical permission, and 2 is actually getting permission from your insurance provider so you don't run into any problems. I would say avoid. I know there have been some studies or some clinics out there that do cancer clients or cancer patients with good results, but I just think it's a risk. All right. Allure Aesthetics, Darwin, can you do blue? Oh, that's a really good question. I like that. Can you do blue and red in the same session? If no, why? Okay, some of the stuff that I've heard is you can't mix wavelengths. It's not true, by the way, but this is what I've heard. Oh, you can't mix wavelengths. The skin gets confused. Seriously? I think we're sort of undermining the skin here. Blue wavelengths are going to penetrate where? Red wavelengths are going to penetrate where? If we put blue and red together, the depth of penetration is completely different. Even though the human eye sees it as a purple hue, it is definitely a blue LED that's emitting 415, and it's a red LED that's definitely emitting 633 nanometers. The skin does not get confused, although the skin might get hot. That's the only thing. So you do want to be careful with your darker Fitzpatricks that we're not exposing the skin to too much heat, that we're causing the melanocyte to be stimulated, and you'll end up with a little bit of POH. If you're worried, so Fitzpatrick, I'd say a dark 3 and above. Increase the panels, so how far the panel is from the skin, and increase your time. Now, before I go, because I'm running out of overtime now, let's talk about dosage. Skin Focus, really quickly. Skin Focus has said, my partner is over the other side of the table listening to this, and his response is amazed. Oh, good. When guys listen to this, they should be amazed. LED should be in hospitals. When I took my mum's, when I took an LED to my mum when she broke her leg, and I was carrying, this massive LED, the nurses were looking at me thinking I was instead of a crazy cat lady, I think they call me the crazy LED lady. But it's clinically proven. Before operation, it helps. After operation, it helps. It helps with so many different things. All right, any other questions? So dosage, last thing, and then I'm going to hop off. All right, so how good is an LED? The LED is only as good as its power that it emits. So if we look at the watts, a standard LED diode will emit roughly 3 or 4 watts per diode, roughly, give or take, depending on the type of LED, if it's old-fashioned, first generation, or if it's a ceramic diode or whatever diode it is. But roughly, let's say 3 to 4 watts per LED. And then there's the number of LEDs in a panel. All right, so anything over 1,000 is obviously amazing, depending on the combination. And then, so that gives us our energy, multiply it by the time, gives us total dosage or total amount of joules. So if you've got a very low powered LED, so usually those panels that you get are a lower powered LED, what you'll find is your clients need to be under there for a longer time. But if you've got a high powered LED, so we're talking one of those big panel, a medical grade LEDs, those LEDs either have high power or many LED diodes. What we can do here is reduce our time to get the same amount of dosage. If you're not a busy clinic, you could probably afford to get a little dome and have your client under there for half an hour or so. But if you're quite a busy clinic and you can't afford a client to be taking up a room and a bed for half an hour, then a 10 minutes, so something that's got high power, low time, so 10 minutes on average. Some LEDs could be on for 7 minutes and will give you the same amount of dosage or energy as, say, one of those other, like little panels do. But that just means your client is under there for 7 to 10 minutes. You can put them under there, they're going to get the full benefit. 10 minutes, they're done and they're off the bed, and your room and your therapist and everything's ready for the next client. So, which is better? It depends. How much do you value that space on your bed? How much do you value your therapist's time? So I think if you're starting to utilize LED the way you should be, which is every single client comes in for pre and for post, for prepping, so 2 to 4 weeks before they have needling or RF or LED, IPL or whatever it is, they have, their treatments. And I'd say the more the better. If they can come in every day, great. If not, every 2 or 3 days. And then post, during that maturation phase. Now, maturation goes on for 90 to 180 days. As collagen matures and cross-links itself, and it becomes stronger, we definitely want our clients to be hopping under the LED, so they're getting the most collagen and the best type of collagen, quality collagen being laid down. So definitely should be part of the skin journey, and I can't highly recommend LED enough. If you're not sure, or if you're doubtful, skin focus, listen up. Your partner can do this experiment. Get some seedlings, some rocket seedlings, put one in one container, put some seedlings in another container, expose one to LED 10 minutes a day for 2 weeks and the other one not. Let me know what happens. It's pretty amazing. That's what they do with hydroponic tomatoes. Stick them under LED, right? So if it does that to a plant, imagine what it does to our skin. All right, if you're interested in more information about LED, we are introducing, of course, an LED, 2 types of LED into the Australian Dermal Laser Institute, and both will have green. You heard that right, green. If you're interested, send us a private message and we'll send you some information out. All right, next week, Gree Tomt is going to join me, and we're going to be talking about education and the importance of professional development. Great to see you. Sorry for keeping you all. It's a little bit later than normal, but I hope you really enjoyed that, and I hope your partners enjoyed that too. All right, have a good night. See you all. Bye. All right, Facebookers. Bye.